Well, good day. Makwithlot is my traditional name, Leslie Bonshor. I am from the Shakton First Nation and also the Nooksack Indian tribe. I reside out in the Semiahmoo First Nations territory out in White Rock, British Columbia. And I am currently calling in from the unceded homelands of the Shakton First Nations people here in Stalo Nation. As far as a role, I'm newly retired. Sometimes I forget how to introduce myself now, but I have been a healthcare executive working in Indigenous health for the last 2 decades, just recently retired, but seem to find myself pulled back into this work a little bit as a volunteer. And that is actually how I got to know Mara many years ago. While I was working with Fraser Health Authority, a local health authority here in BC. I first met Mara Andrews and Kāhui Tautoko when she came to Vancouver at the beckoning of Dr. Evan Adams, our rock star physician leader here in BC. And I really can't recall the setting, likely a planning day or an engagement session of some sort with back then the First Nations Health Authority was really just starting to be established and considered as a province-wide First Nations-led health authority. And Mara was brought in as a consultant. And when we first met, I was impressed with the amount knowledge that she was bringing, clearly from her work and in New Zealand with the Maori on their health and wellness. And we struck up a conversation, and I realized very quickly this is somebody who can see everything from, the 30,000 foot level and piece together the important parts. You have to remember in healthcare, it isn't that easy to come across people who have that whole package of knowledge where they have the understanding of the systemic issues that we face when we're addressing inequities and racism in healthcare, along with this person who totally understands what a very holistic and culturally appropriate healthcare system would look like. So we had some fantastic conversations, could talk and talk and talk for hours, but also just take our ideas and whiteboard them and come up with some solutions that would fit. And one thing I always loved about Mara, it wasn't about working harder, it was about working smarter, right? And so we weren't trying to create a whole new system. We were trying to influence and transform the existing system, not create another one. So I loved having those kinds of conversations with her. And then later on, she had Kane working with her. She had brought Kareen and many other lovely, lovely people that we met. Puri, it was just been a long relationship now with this group of companies and people that have come to be with us here in BC and do this work with us. Particularly with my work with Mara in those early days at Fraser Health Authority, we were, as you can imagine, just at the very beginning of being able to acknowledge that we needed to transform systems in order to truly impact the experiences from a patient level, patients, community, nation-based experiences interfacing with these health systems. I remember a couple of outstanding pieces. So one was not a proof of concept, it was a business case. So really helped us with the business case of creating a primary care community health center in a First Nation that was nation-led, nation-informed, bringing in all the multiple partners from the neighboring communities, including the non-Indigenous people in the neighboring communities. That work that Mara did with us back in, I'm going to say 2008, is finally, to this day in 2025, that health center is now being built, and it is meant to be opened in August 2025. Now, it's not because the work was incomplete when we did it way back when, it was because it took that long. And I want to point out that this was because we were so forward thinking back then. It has taken the whole system this long to catch up to that kind of thinking. And of course, everything has to happen in these almost like little intervals, right, of readiness for multiple levels of government, including First Nations, to be prepared to allow and see that there's benefit, and that the First Nations themselves can run these kinds of things on their own. So that's one particular one that I can bring forward, this legacy of this work that we did all those years ago, to it being the bricks and mortar, the true building is about to be done. I hope that Mara will have a chance to take a drive out there with me when she visits next time and see it for herself. Now, that would have been the early days of us thinking about primary care differently. And I can also say that once I went over to Vancouver Coastal Health in 2015, again, Mara and team and Corrine come along from Fraser to Vancouver Coastal Health along with me. A lot of the work that we were doing was so foundational and so important that we didn't want to lose any of that momentum, but bring everything we learned from that Stehalis business case development, looking at primary care differently, and bringing it and applying it to this new role and this new opportunity in Vancouver Coastal Health. And so there was so many lovely opportunities to bring many partners, all providing primary care, and those wanting to provide primary care together and get them networked. That's the word we used at the time, just to have them come together and start having dialogue. It is now what is known as this First Nation Primary Care Network of many. I think there might be 9 last count, but again, I retired and maybe there's been more added. But what it did was it created this culture of collaboration and coordination that really put First Nations and Indigenous service providers on the primary care map. Right. So now they're part of the bigger system. They're seen as one of the providers, just like any other primary care provider in Vancouver and the whole area. Probably one of the proudest pieces of work that I had any little bit of a role to play in was bringing Kāhui Tautoko into that work and supporting them to support those communities and leveraging our roles and responsibilities and our connections as a great big health authority to help these individual primary care clinics. I think it's now just one of the models that should be followed and everybody should learn from it. And I know that Corrine works still with them and Mara still supports, and that is probably one of the biggest, greatest accomplishments in this province, quite honestly. So it changed how we deliver primary care. One of the lasting impacts that they made was this idea of us learning from Maori and Maori learning from us. So we did a lot of exchanges with them. Many of us went to New Zealand and visited. I think there was a couple of trips that a cohort of us went and brought back our teachings. I also remember her bringing many of the Maori health leaders to us here in Vancouver as well. And we were able to share how we've advanced here in BC based on the things we learned from the Maori health system and what was working very well there, and bring it back and reapply it to our context. So some really good lasting impacts and lasting legacies of those visits, I think, that carry on to today. Not only that, they created friendships, right? Like when Kane and his family first moved here, and he brought his 3-year-old children, and we all watched those 3 children grow up. And then when Corinne came and other relatives came, her mom and dad came, and, you know, as our Indigenous people do, we kind of just claim them. And they've been in my dining room and I've been in their dining room. And so it always extends well beyond just the work and the transaction of the consultancy arrangement to long-standing friendships, which I truly value and love seeing them. And we go through all sorts of changes in life together, becoming grandparents and retirement and PhDs, and yeah, it's been great. You know, one of the most incredible, I think, selling points, if I use that as the marker, is they are so professional and polished. And, you know, many projects I've done with them over the last 20 years, like so many, and everything from strategic planning to major blueprints of flows of information and storage of things. If ever, because I would have different admin assistants over the years, lose something, right? Like, oh, where did that report go, or where was that, you know, paper that we wrote? I would just call Mara or Corinne, and within minutes they would have it for me, because they had such an incredible system of filing and saving and recording and treating the material so, like, with such professionalism, and not only that, but kindness and respect, that they knew it was our work, right? Not their work, of course it is their work, but it belonged to us, and they would always have it readily available to us to share again, over and over again. So Kāhui Tautoko and Mara and Corinne and team are some of the most top drawer polished professionals I have ever had the privilege to work with. I would recommend them 1,000 times over and over again.